This marks the halfway point in our journey in becoming physicians, their transition point between pre-clerkship and clerkship. And so my classmates and I took a few moments to reflect upon the busy year that has passed us and to look at what may lie ahead. These are our stories.
Fulfilling, exciting, and invigorating.
Pivotal.
Fun. Growth. Fast.
Chaos.
Different.
Tumultuous.
An adventure.
Long.
Severious.
Eye-opening.
Cortisol. The way the patient was positioned, I was trying to examine her right side, and her right side was against the wall. The bed was against the wall. And so I thought the best way to approach it was, instead of being on her other side and leaning over and reaching to her right side, I would get on the bed with her and squeeze myself between her and the wall and like do the abdo exam from there. So I was kneeling on the bed, but the covers were slippery, so I like fell down and we were on the bed. It was a huge mess, and yeah, it was not my best moment.
In MF1, I acted as a patient who had aortic dissection, which meant that I was screaming on the top of my lungs for a couple of minutes.
When I went to go take someone's blood pressure and she was talking about invisible things in the room.
Seeing a preceptor perform the vagal maneuver and it actually working, and just being blown away by the fact that things we learn actually work in practice.
Sitting around in a conference room with our med skills preceptors, and they had prepared these handouts for us where we had to come up with differential diagnoses for dysuria, I think was the issue. And people came up with all kinds of random things, and one thing that I said was gunshot wound. And then I basically got made fun of for the rest of the MF, and every time we did that same exercise with any other condition, everyone kept saying gunshot wound and then would like look over at me and kind of laugh, so that was pretty funny.
Okay, so most memorable clinical skills was MF1. Just looking over and seeing that Prima had been sitting in the corner for about 10 minutes with the stethoscope in his ears, trying to find his own heartbeat.
So I met this one woman who just gave birth to a baby girl in Oakville, and she had a husband who at the same time had an AV malformation that kind of, she basically had a hemorrhage and he had a stroke. So there was a happy moment and a really sad moment, and like she kind of was dealing with both of them, and just her attitude about the whole thing and her perseverance was just really amazing.
When I was in Israel, I met this patient who was diagnosed with brain cancer, and instead of being really down about her diagnosis, she embraced it. Her family came from all over the world, and every day they would do something special. And she had a giant flower hanging over her head, like a sort of like she was in paradise. And she just really lived each day.
So I had a patient during the summer electives this summer, and this patient had broken their femur just below a hip prosthesis, and I was going in to sort of do an exam and give them the rundown before they went in for surgery, and they were just incredibly positive and incredibly upbeat and optimistic about how everything was going to turn out. And I'd gone in kind of thinking this was not the best situation, but I was really like moved by how optimistic this person was, and I just kind of, it was a pleasure to like talk to them and get to know them and go over what was going to be happening. So it was a really good experience with the patient.
The most inspiring patients I've encountered were ones during my medical oncology elective, and their ability to just look on the brighter side of things really put everything in perspective for myself.
So one of the patients I'll always remember the most was an older gentleman who very obviously near the end of life and quite frail and in a significant amount of pain, who was so encouraging and just wanted us to ask him questions and practice anything we wanted to do on him, and I mean, obviously we didn't, but we just could not have been more open to helping us learn, and I just thought that was really inspiring.
The most inspiring physician that I've met in Hamilton so far has to be Dr. Reed. She's a general surgeon, which is something I'm interested in, but more than that, she's really passionate about medical education and about making a difference for her students, and she's very humble as well in spite of all of her successes.
So the most inspirational physician that I've worked with is Dr. Andrea Hunter. She's a pediatrician and does general pediatrics, and I've done a few electives with her. And I think she's inspiring because she's so amazing with her patients.
A neurologist that I met, she was always laughing despite the really hard diagnosis she had to give, but I just remember her smile, her giant smile, brightens the room.
So the most inspiring physician that I've met to date was actually before I came back to med school and has continued to be my mentor throughout. And his name is Dr. Tom McGowan, and he works at Credit Valley Hospital. And the reason why is that he is a physician who admits his shortcomings and his faults and never fails to try and learn from other physicians.
Dr. Sagbeson, a glaucoma specialist I worked with over the summer, and because he spent a long time with each patient, even though he was tired and we were behind.
I have to say running. I've done quite a bit of it this year, and it just gives me a chance to think about, like, either think about stuff or think about nothing at all.
Having friends outside of medicine.
I bought a horse. Excellent use of money. But yeah, for sure, just having that has provided some sort of level of sanity throughout the last year and a half.
Chocolate.
Wine, yoga, and my cat.
I'm pretty sure musical kept me sane from MF3 to MF4.
My friends, my family, my future husband, and the gym.
4 things: friends, meditation, cooking, and being a little crazy sometimes.
I learned this summer by my SMR not to wear your pager when you go to the bathroom, because you can go down the toilet.
The sural nerve innervates the posterolateral portion of the leg and is a combination of the tibial and fibular nerves.
So practicing for the OSCE, I was asked what I would observe on somebody that was having an MI, and I couldn't think of anything. But there's 3 things, and it's powered diaphoresis and something else that I don't remember.
So I got double pimped on this one, and I got it wrong both times, and I was an idiot twice. But Virchow's triad is hypercoagulability, stasis, and endothelial injury.
If a patient has asthma, you have to be careful with giving them beta blockers, right?
An apical lung tumor presents as Horner syndrome.
So the thing that I would like to remember going forward from pre-clerkship is how I felt the day that I found out that I had gotten into medical school. That kind of elation and that excitement, I hope I keep that with me, because I think going forward there's going to be lots of challenges and questions about where I fit in and which residency I want to do, and so I just hope that I remember, no matter how it works out, that this is a really good thing, and just to keep that elation and that excitement with me.
It'll be okay.
My favorite quote is something that Arthur Ashe said, and it goes something like this. Start where you are, use what you have, and do what you can. I think that's a good motto for clerkship.
So in the wise words of one of my esteemed colleagues, he always says, strive for mediocrity.
Strive for mediocrity.
In the words of P90X guru Tony Horton, do your best, forget the rest.
No question is a stupid question.
This too will pass.
Try not to cry.
Never be afraid to be wrong, because you don't learn when you're right.
Try to be a doctor.
Stay positive.